Well, hello again. It's Jason Renault with the Alternative Mobile Services Association, and today AMSA Talks is talking to Geremew Wana from University of Kentucky at Louisville. Good morning, Geremew.
Good morning, Jason.
Thanks for visiting with me. You have a new article out I'd like to talk to you about on uh, how people of color, especially Black Americans, are using 911 and 988. But before we get started, tell me a little bit about your background.
Thank you, Jason, for having me. My name is Geremew. I'm originally from Ethiopia, um, and I've done my undergraduate in health promotion in behavioral science, which is actually the same discipline what I'm studying at the moment at the University of Louisville. I'm studying my PhD. I'm second year. I'm almost at the end of completing my coursework, closing to my candidacy. So I've done also another master's, two masters in one reproductive health, the other is in gender health. So as you can see, my entire education career is in the health sector. So I have also worked as university professor for 6 years, public universities, different universities in Ethiopia, before I came here. And also, I also worked in different organizations from organization across organization level, from program level to country director and CEO levels. So I don't know. That's a little bit introduction about myself.
And you have a team here. You have some other authors in this, and we'll talk about that in a moment. But let's just dig into this article, and we'll link to it in the show notes and here in the newsletter so that people can read the article for themselves. The article is "Bridging the Gap, the Crisis Gap, Bridging the Crisis Gap: A Scoping Review of Psychological Distress and Help-Seeking Behaviors in Black Americans Using Crisis Hotlines." Now, this really strikes a chord for AMSA and AMSA's members as we're really feeling the pinch of that. It is through 911, 988, and other crisis hotlines that people access mobile services. So we really want to know why there's any barriers here, and this is what you've revealed.
Yeah. I forgot to mention that I'm, as part of my PhD journey, I'm working as a 988 project here in the state of Kentucky. So I'm working as graduate research assistant, and one of our co-authors is Dr. Brian Combs. He's the lead, the PI of this project. So this scoping review is the first step, where we want to see what has been published, what has been said here so far, and we want to survey these literatures and what's really challenging African American from accessing this service. Because during our research, we find out that um, most of African American access emergency service in the case of mental health, not 988, which is also the national, as well as
Mhm.
the state level hotline service for this kind of case, to address the crisis issues and link them to the resources they need. So African American are not accessing this service, and we want to know what's really holding them not to access that. So that's why this study is all about.
And you looked at several surveys here. You use a set of mechanisms to determine what the surveys should, which surveys you should look at, and they're all listed in the paper that you produced.
Yes. So actually, we mapped all the publication out there published here so far. So we went to the library research. We addressed 6 libraries, as you can read from our article, and we rigorously searched and pull out all the publication that fulfill our inclusion criteria, which integrates access, mental health access through using hotline services. Unfortunately, we don't have much hotline services, but anything that's published under that title, we pulled out and we refined it. And finally, we end up with 10 prominent articles which we included based on our inclusion and exclusion criteria, and we synthesized that using Covidence software. We use Covidence and we synthesize that, and finally we end up with 6 major findings, which I hope we'll talk about that later.
Yeah, let's dig into that in a moment, but tell me about these 10 articles that you found that you decided to work from. This is over since 2011, I think is the earliest one. It's a very limited amount of information.
Yeah. Before the launch of 988, that's excluded. That's why you see our cutting line is 2010. So the articles that one of our inclusion criteria is the year of publication. We use from 2010 to 2025. So those are the timeline we included the article. So before the launch of 988, we haven't included that. Because one, the system is now well established. The other is we don't know the access level as well. So we excluded that and we integrated those. So with that search strategy, we end up getting 1,300, overall 1,300-ish articles that fulfill our criteria. And we did the abstract search, abstract screening, and full text screening, and finally we did extraction. So those 10 articles are the articles that fulfill our inclusion criteria, which is not only the time of their publication, but also the content. Are they addressing their participant accessing mental health service through hotline mechanism? So if any article that's published out there accessing mental health through other mechanisms are not our interest on this study. So we specifically focused on accessing mental health services through hotline service, including 988 service.
Well, before we dig into the 6 findings, I'd just like to clarify and have you clarify, what's the impact? What is the consequence of Black Americans not having or not using access to 911, 988 and crisis lines? What's the net result there?
Yeah, that's a great question. That's, as you know, health issues are primarily it's like human right. As human, you need to access health service, which of course the state provides. So 988 luckily is one of the great resource that's meant to be rendering service for everyone. So one, everybody should access that. Second, mental health issues are not something that gives you time. So some of them are calling with suicide ideation. So if you get the chance to listen to crisis counselor, what they have been through and how they are dealing with their client, you'll be amazed how the service is very important in saving, the thousands of lives every year. So they should be also accessing this service. So African American are not accessing this service, primarily because one is existing systemic issues that we found out from the articles, because the existing system is fear of health service. That's also one of the systemic issues that should be addressed. So 988 comes in, and it's not isolated incident that people are not interested to access this service. But this is also the result of the existing issues, which is fear of health service, accessing medical health service. So that's the same way it's been treated. It's been treated for 988 service as well. So not only the existing, but also the current, coupled with the current issues, which is also if you following the news, there's a woman who called to access 988 service and she ended up in jail because of the escalation, between the crisis counselor and the client not understanding, because she called to get service for her son, and finally that was escalated and ended up in prison. So we want to avoid this kind of challenge in accessing health service. We believe that everyone should be represented. We believe that the service should reach out to the where people live. In this case, they have to be communicated in a way they understand. That's one of the issues that we highlighted. Lack of training and proper culturally sensitive communication also required, so that they will trust the system. They will come back to the system and access this very life-saving service.
Oh, we can only hope. We can only hope and work towards that.
Yeah, this is one way to bring these issues to light and throw there to the policymakers, to service providers, and also to organizations like yours to awake the people in power, not only people in power, but also service providers as well. And also interagency collaboration is required, because it looks like isolated service. So we have to work together, to address those health problems, not to, limit the health problems. So we need to work together so that everybody should be able to access this service and save millions of lives in the end.
And in an environment where people are so starved for time, prioritizing this sort of additional training, or maybe additional is not a good word, is often just gets pushed off the table. Is this also sort of a byproduct of a starved system?
Um, Yes, I would say that, because one of the articles that we included in the study highlighted that, saying that this is the upstream level problem, not only the institution, or this is not something that will leave to 988 or hotline services, but this is the overall policy level problem. Yeah. So this is not to blame the crisis workers, this is not to blame 988 agencies, but the training should be more sensitive. The training should be more integrative. The training should be more reflective of the community. So that's where we need people at the policy level. That's why we need people at the table, as you mentioned, so that their voice be heard and their challenge will be addressed, so that they'll be represented properly, just to embrace their concern and find solution to challenges of access.
Well, let's dig into those 6 findings that you have listed in this paper. And the first is around the hotline utilization.
Yeah.
Tell me about that.
Yeah, the first one is underutilized, meaning that African Americans are not utilizing in the way they should utilize the service. Primarily, as I mentioned earlier, that's due to the existing systemic problem, and also the not having culturally sensitive training, we believe, because their issue are not, there's the communication gap between the client and the crisis counselor. So due to this, they tend to call to 911, and also when their problem is worse, then they go to emergency service instead of addressing the problem at early stage, at preventive level. So they are underutilized. 988 service is underutilized by African American. So that's one of the findings. Even though there is increase in number of utilization across years, increase the number of people access 988 service, but African Americans are still not to the level they need to access this service.
And that's so, even though these call volume is increasing enormously in both 911 and 988.
Yeah.
So it's not reflected.
Yes, even though the 988 service has increased over the years, so the call volume I'm talking about is increased, but African Americans are not to the level of their population size. For instance, in certain areas, they are 30% of the total population, but they are represented like less than that. They're not calling, they're not accessing the service. This is not because they don't want to access that service. This is not because they don't have mental health issues. This is because the existing fear of the system and also the challenge, the hurdles that they encounter while they are calling to the service. So that's the underutilization we're talking about.
And one of those fears is your second finding is that these calls get escalated.
Yes, yes, that's pretty much tied up with, you know, it's not like independent finding, it's interrelated
Okay.
finding.
Yeah.
So we are seeking to bridge this gap. That's why the title is Bridging the Crisis Gap. So we want to address this problem by integrating the challenge and seeking amicable solution for all of them. So that's why the first one, underutilization for my crisis line. The other is policy involvement. The like I mentioned earlier, this is one of the escalation process, the escalation incident that you encounter. So if they encounter police, then that will spread across, the community, and they fear and they can't call next time. So that's also challenge address accessing the service.
And you mentioned that case of the woman calling on behalf of her son. And that we've all heard those cases across the country. We have one here in Oregon where simple psychiatric emergency and the police show up.
Yeah.
Really? Not necessary. So I'm hearing you on this. Now, the third finding you have is about widespread mistrust.
Yes.
Now, tell me a little bit about how you've discerned that.
Yeah, the sense of safety and the sense of trust, trust is not built overnight. Trust should be, it's a process, what they have encountered here so far, the past, the present, and the future. So it encompasses all the the mindset they have towards the modern health service, not only limited to 988, but in this case we're talking about 988. So how do they trust the system? Are they calling to get the service, or are they calling with a mindset that, oh, I might end up, unnecessary altercation, and I might end up, costing not only my health condition, but also, exposed to another situations.
Hmm.
So they don't call, they don't engage the service. So we need to work on building the trust between the 988, the crisis hotline service, and African American. So that starts from embracing them, bringing them to the table, and getting their voice, what are their concerns, and how do we be able to address those challenges. That's very important. So trust issues are also another finding we get from the published article. So if you see there is association high stigma and mistrust of providers, predicting lower help-seeking behavior. So this is also established across studies.
You also found in your fourth finding issues with the workforce, that there really are sort of systemic shortages and gaps in the system, which just seem to be persistent.
Yes. Uh, Data, at the moment, I think organizations are not also collecting data due to these DEI laws, I believe.
Hmm.
So we need disaggregated data. It's not about, I'm not interested talking about DEI issues, but it is some sort of we need disaggregated data. We need data on African American, we need data on the other races, we need data on who is accessing those services, who is not. So this is health issues. It's not uh, the other way around. So how we bridge that gap, how we address that, but we don't have those data. The data is not available at the moment. So that's the challenge we're facing. So even to do further study and how the problem, what is the magnitude of the problem and how we can address those problems, we need data. We need to ground our solution, our intervention based on data. So with absence of those data, it's difficult to, predict what's going on and what's happening on the ground. So that's one of the challenge we experience. That's why you see publication from 2011 in 2023. There is no in between much studies. So we need more studies to do further analysis.
We're just going to have to put an asterisk around this whole generation because of this new absence of data.
Yeah. Yeah. And if you're really looking for the specific data that like we did, You don't find it. You find a lot of it. You'll be overwhelmed with, comprehensive data. But if you're looking to, if you funnel that into specific area like we did, you can't find much data on the area in study.
Okay, so that's a big step backwards.
Yeah.
Um, let's talk about the sixth recommendation. It's really I think the most complicated one in that Black adults are, you're just right, that Black adults are significantly more likely to recommend calling 911 or visiting an emergency room rather than using a crisis hotline. Now, often a crisis hotline has local experts, people who are licensed professionals, people who can spend the time. Why skip over that opportunity? And maybe I'd asking you to repeat yourself, but it seems like that's a much better option for people in crisis often than calling 911.
Yeah, they are better. We have another studies coming up, which is from the other lanes, the other layer from the crisis counselor and supervisor side. They have their own challenge as well. Uh, with that in mind, I think the challenge is they are well trained, they are better trained with respect to other crisis services, but still, it's not enough. It's not enough. Like I said, they need to get that voice. They need to sensitized about this topic to address in specifically in certain communities or people of color. How do they interact, and how we can make use of cultural elements for better, and instead of like making us creating division and finally escalation. So the crisis counselor needs to train about the cultural elements and improve their communication so that there will be more. That's also another issue related to trust that I mentioned earlier. So they need to be more training, the refreshment training. They do demos, and they do a lot of training how to handle the abusive callers and all that, but the cultural element is missing, I believe. So we need to integrate that cultural element as well in the training.
Seems like our work is never done. But but I'm glad you're
A
doing this
lot, a
work.
lot need to be done. Yeah.
I'm really glad you're interested in this subject and interested in this work, and I hope you proceed and those future papers, we're looking forward to seeing them soon.
Yeah. Thank you so much. Yeah, we're working on that, and mental area is like personal to me. It's something that we need to address. Everyone is struggling, and people are affected. So I think this needs more attention, and 988 is a great resource. So we need to utilize, and we need to help address the challenges and barriers to address it, but barriers that hindering people not accessing. So once we do that, I think we will make use of that resource massively, I believe.
Thank you so much, Geremew. Good luck.
Thank you for having me.